One of the members of the National Assembly this morning said in the Montreal region, schools are the main driver of transmission of the virus. Is that true?
In fact, schools is as open in the community are a driver of the virus, but it's not only the schools. There is also, it can vary from one subregion to subregion. The outbreaks are going up, going down in different places. As we know, when we open schools, there is some transmission in the community that is added, but I think it's a mix of things. It's not only one driver. That's schools, workplaces, and communities and homes too.
Okay, so just to be clear, that's not true then, that schools are the main driver.
They are part of, but not the main.
Okay. And my second question is also about schools. It's about to pick up on Ketsy's question about the ventilation. Is there going to be a province-wide plan about ventilation, or is it up to each school board or service center to decide what it wants to do?
Well, first we want to have a view of the santé publique first, because as you know, as I mentioned earlier, the opinion of the OMS is very recent on the way this goes through air. So that has raised the question again. And I think that this was the main driver. Now, secondly, I think we can act locally much faster than we can. We have, and that's the reason I'm saying it's not only an issue with education, but with our health building, is that we have a building that don't have ventilation. So we need to be more specific on certain cases where if we have this opinion, then we'll act very accordingly, and that's the reason we've asked the responsible for our procurement to look at and have a detailed list so we can present those lists with our experts and make sure that we act very quickly on that.